Thousands of doctors all over the planet are rediscovering the lost wisdom of heliotherapy and prescribing sunlight to their patients and seeing amazing results. This is the story of Dr. Kelsey Dexter, who went from sunlight deficient and circadian disrupted and sick to now healthy, thriving doctor who's seeing amazing improvements in her patients' lives through simple lifestyle changes, often saving them from a lifetime supply of side effect-laden pharmaceuticals. This is Big Pharma, and he does not want you to know about this.
When I was a teenager, I was acutely aware of this message that the sun just causes skin cancer and aging and wrinkles, etc. And I have been actively avoiding UV exposure to the extreme for my entire life. I started my young adulthood with extreme sunlight deficiency. And then I went into medicine, and we, spend 36 hours on call and don't sleep for 36 hours. So couple the sunlight deficiency with severe circadian disruption. And I started feeling the sensation up the back of my leg. I started having shooting pains coming from my facial nerve into my face, like trigeminal neuralgia type of picture, and went to my own primary care doctor one day. And he told me, he said, well, I don't really think that this could be anything else but MS. And I knew at that point that I was not going to take medicine for any kind of autoimmune condition, and that I was going to get to the bottom of what was going on. I started really looking at risk factors associated with multiple sclerosis. And, there's very clear vitamin D deficiency association. I kind of dove more into the latitude data. So, the higher your latitude, the more incidence of MS there is. And it sort of clicked in my brain, like, I've got to make some vitamin D, right? So I started a dedicated sun practice. I was, sitting out in the morning sun, trying to acclimate and build a solar callus. I was very, very sun sensitive, as you can imagine, right? Because I hadn't had sun exposure in 25 years or whatever to any appreciable amount. But when I started spending 10 to 15 minutes in the morning sun over the course of about 1 to 2 months, I realized that I could spend 2 hours in the midday sun and I wouldn't get a sunburn. Of course, I started feeling much more energized, and my nervous system relaxed, and I started feeling better overall. I was already in the process of experiencing these changes, and then I learned about artificial light. I learned about blue light and how that was impacting me on the other side. Everyone in my family has a wardrobe of blue light blocking glasses that will fit whatever, circumstances needed to change what's normal. Like in Jackson, Tennessee, you will see blue light blockers out at restaurants at night. I don't know, the effects have been cumulative. Like every symptom that I had is gone. Like I am perfectly healthy, vital, and like I have no more nervous system issues. So there's a direct relationship between high parathyroid hormone levels and vitamin D deficiency. And I get referrals all day, every day for elevated parathyroid hormone, and the cause is vitamin D deficiency. I mean, I've told so many people about intentional sun exposure at this point, and we've corrected so many patients' vitamin D's, robustly corrected like their deficiency and normalized their hyperparathyroidism. But my most challenging patient in this calcium realm has definitely been someone who has no parathyroid glands, who has chronic hypocalcemia. She ends up getting IV calcium infusions about every week to keep her alive, because we can't keep her calcium up otherwise. So this patient, I asked to sit in the sun, right? After I learned about all this and learned the harm that I was doing and that I could do so much better by her, I got her to sit outside for 10 minutes every morning, and her vitamin D normalized. She's been staying out of the hospital for the last 6 months, right? With just this little bit of behavior shift after years of misery. So that's probably my most successful patient story.
From the creator of cold thermogenesis and grounding comes sunlight. If you have any of the following conditions, ask your decentralized doctor or quantum health coach if sunlight is right for you. MS, hypertension, fatigue, chronic pain, depression, dermatitis, vitiligo, scleroderma, asthma, or cancer. Sunlight wasn't made for just plants and animals. The creator designed this to benefit humans too. Side effects from sunlight may include burning, but only if you haven't built your solar callus. In order to receive sunlight, please don't wear sunglasses and start slowly, with sunrise first and then UVA rise and then UVB midday sun, in increasing dosages until your body's used to it. For more information, please visit lightenvironment.org, a free information site to show people the light and spread greater health worldwide.